Thank you for meeting with me again, Dr. Dorsey Holloman.
Of course. It sounds like you've started to collect some data. How well do you think your quantitative and qualitative data map onto or connect with one another as you start to analyze and interpret your results?
Great question. As a reminder, we're using an exploratory sequential mixed method study design to understand the transition of care needs of young adults with cerebral palsy or CP. So we're first conducting interviews with young adults with CP and their family caregivers, and then we're collecting data from the electronic health record to understand the magnitude of these gaps in care. And we're going to use this information to design a transition of care program. So we heard from families how challenging it is when communication breaks down between their different providers. And a lot of these patients see a lot of different providers. And so we're going to collect from the electronic health record data on the number and types of specialists that these patients see. And so we wonder if patients that see a higher number or a greater number of specialists, if that's associated with longer delays in accessing recommended medical treatments or equipment.
It sounds like you've gathered some rich interview data that's guided your quantitative variable selection.
Yes, I think so. We haven't yet coded the interviews, and so these suggestions came directly from what patients and their families told us in interviews.
So those suggestions can be helpful to guide and understand the quantitative results of your study. However, you're right, you will need to synthesize the interview data to fully understand your qualitative data and interpret the study findings.
Hey, Professor, how do I synthesize and interpret results from qualitative data?
That's a good question. There are different approaches to synthesizing and interpreting qualitative data in applied health research. I'd like to recommend a descriptive qualitative approach that focuses on informed principles of phenomenology. Doing this will allow you to center your findings on your participants' experiences, values, and needs, while also keeping in mind your own clinical expertise and then thinking about how you can control your own biases. I also would recommend using content analysis as your coding strategy.
Okay, that sounds like a good plan.
So the standard approach to qualitative coding is a team-based coding approach. This is because qualitative research is an interpretive science, and we want to make sure that there's some checks and balances in place as you think about coding and interpreting data. So here are the recommended steps. Step 1, you want to be sure everyone on the analytic team has some background information about the topic area of your study and knows the research question. The next step is for everyone on the team to read the same transcript fully. Then you start at the top of the transcript and work together to highlight chunks of text that represent information you want to capture and is related to your research question. This chunk of text is a quotation that you will label with a code. It represents the meaning of that quotation. Step 3, you'll continue until you've fully coded this first transcript.
Wow, how long does that take?
It really depends on the length of the interview and the complexity of the data, but you should plan for a few hours for the team to review and code that first transcript together. So the list of all of your codes and their definitions will become the codebook. Keep in mind that as you start to assign codes and looking at additional transcripts, this will be a modifiable book that will evolve over time.
Hey, Professor, are codes qualitative findings or results?
That is a common misconception. No, they are not. You're going to need to go through cycles of pulling codes and code reports, also called queries, and then look at the data and look for patterns as you review the whole data set. So what are the commonalities and unique ideas across all of the interviews? These patterns and unique ideas will come together to really form the results, also called themes, of your qualitative data.
Hey, Professor, that analysis process to identify themes confuses me.
It's abstract until you do it. Making soup is an analogy that might help you better understand the analysis process. Check out the hyperlink with details at the end of this video.
Okay, that analogy makes sense to me, but I'll check out the soup hyperlink too. Our quantitative data analysis plan is to collect data from the electronic health records of participants. Then we'll use that data to conduct logistic regression analysis. In the logistic regression, we're going to explore factors that impact whether or not a patient had transitioned to adult care discussed with them. The interviews that we conducted will guide which variables we test in the logistic regression.
Hey, Professor, how do you integrate your qualitative and quantitative findings?
That's a good question. So you'll complete your analyses of the medical record data and identify your quantitative results. Then you'll integrate the qualitative findings with the quantitative results by comparing them and seeing how they support and add to each other. Using an integration figure like a joint display or integration table can help. Those merged results are the study findings on participants' transition of care needs. You'll use the study findings to inform the development of a transition of care program. How do you plan to share your study results?
We want to create an infographic. It will highlight key findings from our study and how we will use these findings to inform a transition of care program that meets the needs and values of youth with CP and their families. I think sharing it broadly with our participants, as well as the CP community, would be a good idea. We would also like to create a podcast about our findings and the new program that we will create for these families. Hopefully, Youth with CP will listen to it and inquire about our program so that they can join it.
That sounds amazing. Good luck.
Thank you.